one of the most important muscles. Now, who can share with me the number one muscle of respiration?
I would say diaphragm.
Absolutely, thank you very much. So we have the diaphragm. And when I ask people about where's the diaphragm, a lot of people go, oh, it's here, it's here. And what is so amazing is that the diaphragm has this 3D circular nature to it. It doesn't necessarily have a front or a back or a side, and nor does our body, because our body is this one continuous, amazing matrix that we've been given. So what I'd like to do is I'm going to share my screen and I'm going to show you here some of the information and some of the funky photographs that I have within the diaphragm. So if there are some photos here that make you go a bit squeamish, just pop your hand over and listen to me, okay? Because there are some quite cool pictures here. So bear with me whilst I just find my screen here. And I'm going to come into this being the first picture, of which I took when I was at the Von Hagen exhibition in London. Bit of a bad girl, shouldn't be taking photographs, but we're getting straight in, right in the guts of it, aren't we? Anthony's got his hand over his mouth. So we're coming straight in for you to see where the diaphragm is and the importance of it. Now, this specimen here, I have to say, is incredibly special because this is called intestinus reversus. Everything that you can see inside here has been and is reversed within this patient, which is about 1 in 50,000 people. So have a look here where my arrow is. You should all be able to see my arrow. And you can see here the separation of the diaphragm between where the heart is and where the liver and the stomach would be, which is in this hole here. Usually the liver would be situated on the right side and the stomach more so to our left side. And we can see here the separation, and this is where there is some beauty within the connectivities of all the different systems within our body. Because what do you see here sitting on top of the diaphragm? It's the heart.
The heart.
Fantastic. Thank you, Emily. No, Kerry. Thank you, Kerry. So the heart says roughly a fist size, okay? And that heart sits within a bag. And we can see here that the bag has been cut. The bag has been cut around from and taken away from the heart, other than the piece that is actually connected to the heart. They are fascially connected. Now, if this diaphragm, our number one muscle of respiration, is not moving up and down like a jellyfish, then this other pump that is our heart, maybe that ends up being compromised if we're not breathing correctly. Now, our breath is the really connectivity into one part of our nervous system that we are all really interested in talking about at the moment. Now, which part of our nervous system, if we're breathing in a really beautiful, calm manner, which part of our nervous system are we, which one are we talking to? Which one do we want to connect to? Anybody? I've got quite a few of you on here today, so unmute yourself and tell me, because I can only see 5 of you on the right side of my screen at the moment. If we're breathing in a calm manner, we want to be able to connect to our
We got parasympathetic in the box.
Fantastic, thank you very much. The parasympathetic nervous system, our rest and our digest. And this is mainly via our nerve called the vagus nerve, which you, I would imagine, have heard about, the vagus nerve. The vagus nerve is a cranial nerve that is situated and originates from our brain, number 10, X, the number 10 in the Roman numerals. And it has really quite an interesting tortuous pathway from our brain down very close to our neck, close to left and the right side of the heart, all the way down through our diaphragm, goes through the diaphragm and connects us to our digestive tract, as well as being connected and influencing through our heart. So what I love about this is the sense that there is a separation between above the thoracic region and below the abdominal cavities. Now, I was just recently geeking out on some anatomy the other day, and it is absolutely amazing to see actually how transparent the diaphragm is. It's not a thick muscle. If any of you have been to Bali and been into a massage room, you often just have like a sheet or a shower curtain separating you into independent rooms. This is how the diaphragm is. It's a thin membranous structure that's like the shape of an umbrella or even a jellyfish, okay? And it has the ability to shift and move on our breath in and our breath out, which starts to shift the pressure above and below it. So we have this analogy of a diaphragm like an umbrella, or even a, jellyfish, or even Marilyn Monroe's skirt. Do you remember when Marilyn Monroe's skirt got blown up from underneath and it kind of puffed out? We've got this big, free, circular edge that we need to consider. Where does it attach? Because if we know where the free edge of that circle attaches, we can help direct and cue our breath into these different areas for people. Because often people may be in a shallow breathing situation where they're using muscles up through their neck to breathe, opposed to the diaphragm moving more so. Because we've got trauma, we've got breathing dysfunctions that may look like smoking, it may look like slouching. You might see Johnny at home on his computer that's 12 years old and doesn't get off his computer, and his head sits forwards and his diaphragm can't work properly. Or you've got your sister that's 10 months pregnant, she's got a really big belly, and this is influencing her breath. So we're going to look at that very, very soon. So just have a look at this umbrella. This is a fancy pants umbrella, and I bet you they cost a truckload of money. But what I love about this umbrella is, look at the black dot in the middle. This is where, if we could imagine that the heart sits on top of that umbrella. And look between where the heart would be and the front region of our body and see how short that is. And then start to appreciate how long the back of the diaphragm is. Because we've got some really varied attachments that we can see from the little cartilaginous tip. If you will touch your bottom of your sternum, there's a little bit of a cartilaginous tip here called the xiphoid. Don't worry about the name, but just appreciate where it is. And then we're going to go on this little circular journey from this point and just follow my fingers all the way down into my back here. So appreciate the front attachment and the back attachment. And can you see the disparity between the front and the back? So the back is really, really important of where the diaphragm attaches to. It attaches to the lumbar spine. And we very much talk at times about the breath and the abdominal breath. So what about the sense of this circular 3D nature of this jellyfish, of this umbrella opening, and having a sense of expansion in this 3D capacity, front all the way through to the sides and all the way down into the back of the body, into the lumbar spine, which is quite low actually in the spine if we think about it, when we think about our breath being up here. Because the tip of our lungs actually come up just where my fingers are. The top of the lungs are really quite high and the back are quite low. So I'm going to skip past this one. So what I'd like for you to also get within this diaphragm umbrella nature of these attachments, we've got structures going through the diaphragm. So we've got holes in our umbrella, right? And just have a look. We've got some fancy pants names here. Don't get too worried about the names because I will abbreviate them for you and make them a little bit simpler. We've got 3 openings in the diaphragm and they occur at different levels within the diaphragm. The highest one, the highest hole, and the structure that comes through that is our largest vein in our body. Our largest veins carry deoxygenated blood back up to the heart. So it's creating this sense of, it needs to create a sense of pressure differentiation to try and almost suck the blood back up from our legs, because we've got gravity. Gravity is a pain in the arse sometimes, and it can be quite challenging, gravity. So we also have our calves, our calf muscles. Now, our calf muscles are known as our second heart. Our calves that pump are very, very important to help the blood come back up into our upper body. That's why when you ever seen changing of the guards at Buckingham Palace, you'll see the soldiers slightly leaning forwards and backwards, so their calves are activating, so they don't fall over in front of old Queen Elizabeth. Imagine fainting in front of Liz. I don't think she'd be too happy. So we have the largest artery, sorry, the largest vein. Then we have the esophagus, which is our food pipe. And then we have the aorta, which is our largest artery that carries oxygenated blood. And that comes very, very, very close, slightly off to the left side of the spine. So if our diaphragms maybe not working to the best of their ability, start to appreciate here how the breath may even affect our digestion, may affect how our blood is getting pushed around the body, our fluid dynamics we could use as a collective term. So the fluid dynamics and the diaphragm pumping is so important. Deoxygenated blood, oxygenated blood, pumping, pumping, pumping. Okay. This is a bit of another squishy picky, okay? This is like the whole top of someone's body's being taken off and the heart's been taken out of its sac, and you can appreciate how the sac is connected to the top of the diaphragm. And then we've got the tubes here. The tube on the left is the aorta. You can see it has a thicker outlining. And then this is the inferior vena cava, the vein. Amazing. Amazing, just even the lines of the fibers of the muscle here. I get a bit excited. Okay. So having a look there, pretty basic structure. Just wanting to appreciate the difference between the front and the back attachments. What I'd like to share with you now is that the diaphragm, or the breath in total, has these three interesting neurological connections that we need to speak about. So there's three nerves that are used in respiration, okay? And we can see them here of where they are within the body. So we can see here, this picture right at the top, we've got the brain. Looks a little bit like a cauliflower. Now, the stem of the cauliflower, this is called the pons and the medulla, fancy names, called the brain stem. Just right at the base of our skull is where that sits, okay, is where it's located. And these areas within the pons and the medulla have some very, very important parts of monitoring our breath and our respiration. And it has input here from, here on the right, lower right, you can see the diaphragm and the intercostal muscles that sit in between the ribs. Then we can start to appreciate here the accessory muscles, more so the intercostal muscles called the internal obliques, and the internal intercostals. And these have pathways back up into the brain. They kind of connect and talk to each other. So let's slowly work our way down. Number one, we're going to talk about, this is quite cool, C345 keeps the diaphragm alive. And these, the C component means the cervical spine. We've got 7 vertebrae within our neck. And C3, 4, and 5, these 3 nerves all come together to make the phrenic nerve, it's called. And the phrenic nerve stimulates the activity of the diaphragm. Now, this can work the opposite way round, to let you know. If the diaphragm is not working because we're in a breathing dysfunction, maybe you're wearing a bra that's too tight, or maybe you've got your skinny jeans on and you can't breathe properly, then maybe the phrenic nerve's also going to get compromised, leading to neck dysfunction. It can work reciprocally. Okay. So yeah, the phrenic nerve that comes from the neck has a similar pathway to the vagus nerve, comes all the way down, supplies the diaphragm. Here's a little example. Do you remember Christopher Reeve's Superman? Superman, unfortunately had a horse riding accident and he broke his neck. Now, he broke his neck at the level of his upper neck, which was at the C345 level. And because that's where he broke, he then had the inability to breathe by himself, which was why he was on this respirator. So the neck function in relation to our diaphragm is interconnected. It's important. Okay. You can just about see it on the picture. It's quite fragile here, coming down to the left and the right side over the heart into piercing the diaphragm. So C345 keeps the diaphragm alive. Right, so that's number one, phrenic nerve. Now, we've spoken about this vagus nerve that seems to be really trendy right now to talk about. It's like the polyvagal theory and the vagus nerve and all of these things. So let's just have a little bit of a look. The cranial nerve 10, X10, is the vagus nerve, and it innervates the diaphragm as well as the movements in the larynx and the pharynx. So have a think, when you're doing your breath work, do you think sound is going to be important in relation to the connectivity of our breath, our release, our fifth chakra, and our whole sense of maybe emotional trauma, our voice that hasn't been able to voice? I've gone fully goosebumped, so I think that's a yes. So really get that sense of the vagus nerve connecting with the pharynx and the larynx, okay? If I haven't voiced, and maybe if I'm not voicing, then maybe I'm held in a sense of sympathetic tone activity, which can really be quite detrimental to the rest of our body, right? So it provides parasympathetic stimulation for our heart and our digestive system, which is going to help our digestive system work. When people are in, say, Shavasana or in breath work, expect to hear some tummy rumbles. And if people get embarrassed, say, it's okay. We want to hear your tummy rumble because we know that you're tuning into your parasympathetic nervous system, which is where I feel healing is going to happen. This is where the magic happens. When you have people that are just down, almost downgrading from that sympathetic, high-toned, traumatic characteristics in that person, for whatever they've come from, whether it's a psychological trauma, a physical trauma, however it's wrapped up in the body. Once we get that breath and we start to come into allowing the ease and the connectivity through the breath, yeah, that's when the gold's going to happen, and the body can start to allow the healing and the unfolding to happen. Okay, so what have we got? We got the phrenic. Now we've spoken about the cranial nerve from the up in the skull, and then we're coming down to the posterior thoracic nerves. Okay, they are, let me just jump in and find Charlie. Charlie's in his box. Oh, and he hasn't got any hands today. Oops. So here we have the back of our spine. Okay, and the back of our spine, if we look at the front of it up through the rib cage, this is where we can see where these nerves come through, this posterior thoracic nerves. And they are stimulating the intercostal muscles in between the ribs, okay? So they're really, 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 really important for the sense of the small intricate muscles and the movements between each of the ribs. How many ribs have we got? There's a question for you. Anybody know how many ribs we've got?
12 pairs.
12. 12 on the right, 12 on the left. So we've got 24 ribs in total. Quite a lot, really. And it's quite a beautiful region for protection of our heart, our lungs. It's there for a huge amount of muscular attachments of our upper extremity. So please do be mindful of how much our upper extremity can influence our thoracic cage. And it's also got other muscles that are connecting from one side of our shoulder all the way down to our buttock on the other side. So it's a very interesting transitional area between our extremities. Okay. Any questions? Let me just bring it back to you guys because I'm rattling on. So any questions from anybody so far about this anatomy?
There is, first of all, there are compliments coming about your T-shirt, which you need to know about.
Don't you just love it?
Yeah, people love your T-shirt. And there is a question from Michelle, which is this where orthostatic intolerance comes in?
Orthostatic intolerance in relation to blood pressure, I believe.
Michelle?
Yeah, I have orthostatic intolerance, and it's more about just fluids going from the down below back up to the brain, really. So I found it quite interesting what you were saying about the calf muscles. That's new to me. Pumping up, upwards, you know.
Yeah.
The fluids, because yeah, I can find that the fluids don't go up enough and get stuck down south. So you know,
So when you,
there's not a lot that people can
am I
do.
right? From when you're sitting
Pardon?
and you come from when you're sitting and you go to standing, you can get a little bit wobbly.
Yeah, or I can't stand up for too long or even sit up for too long,
Right.
because then the fluids just pool, brain fog and things like that.
Right.
What you're saying about the
calf
calf
muscles.
being
Yeah.
a second heart, so I could pump them more to
Get
move.
pumping those calves, girl. Whether you're sitting down or even standing up, you can do like little
Yeah.
trick trotting, kind of get your calves going. Yeah, because it's common that people can faint.
Yeah, I didn't know that. Thank you for telling me that. It's
My
a
pleasure.
really
And
good tip.
really, really keep your breath moving to keep that fluid going, because it's such an important part. Yeah.
Well, it was when I heard you say C3, 4, 5 keeps the diaphragm alive. Yeah. Also, you know, I find that I don't breathe enough unless I can't. So that's kind of a inflammation of the spinal cord.
Yeah.
Yeah.
Okay.
So conscious breath work is actually helping me maintain health, you know.
Yes.
So I'm wondering more also about the C3, 4, 5.
That's right. What's happening to your neck? Have you
And
had
how
any
we
neck
can?
stuff?
Well, it gets very stiff at times, and the brain stem also gets inflamed. But I'm just wondering if you've got any tips there about how to treat that. What would you recommend?
Go and see an osteopath. I'd be seeing an osteopath. I'd see a cranio-sacral therapist, and just go check in with your mechanism. To be honest with you, because there may have been something that had occurred even through birth. You know, however many years ago, and you know, etc., etc. Go see an osteopath.
Yeah, I do. It's just not got it yet, but thank you for the tip. Cheers. Cheers.
Are you near London?
No, not at the moment, but I can get down there.
All right, because there's a great osteopathic college there with students, so I can the osteopathic college, the London College of Osteopathy. It's changed since I was there, but there's a brilliant students clinic, and they may be able to help.
I'll check it out. Thank you very much.
We're going to be asking you before we close to put your email or some way of contacting you, so people, if they have questions or if they want to book a session or if they want to take one of your fabulous courses, they can find out more about you. So
That
we'll
would
get your
be
email in the box. Yeah.
a very good idea. I will do that. Okay, any other questions before I keep going? Because I'm really aware of time and I'm a good chatter. So any other questions before I get going on some other juicy stuff? Okay, we got one new message.
Sorry. While you are saying that diaphragm sizes front and back, then I start to breathe, try to be aware of my breath and take breath at the back, and then try to feel it as much as possible. Yeah, it makes a difference. But is there any other tip to breathe differently to feel the?
You know how I really like to feel that breath into the back body is when you're in child's pose. Give me a nod if you know child's pose. Yeah, okay. So if you're in child's pose, your knees are wide, your hands are forwards. Now, often your knees are going to be on your stomach's going to be on your thighs. This, then you can get a sense of encouragement of expansion into your back. Okay. And also see whether you can get a sense of expansion into your lower ribs. See how I can move my left and my right side independently. There goes my right. There goes my left. We have the ability to get conscious connection to these posterior thoracic nerves and to these muscles, and we can really consciously bring a sense of expansion one side opposed to the other side. And we can also get that into the back body as well with give child's pose a go and see if you can do that. Having someone's hands resting on your back whilst you're in child's pose also gives you that neurological touch feedback, which is really, really lovely. Even if you get someone to put a bit of pressure, you then have that ability to be able to get that expansion through the back of the body. Good question. Okay, I'm going to keep going because this is also a really interesting share. Okay, so let's come back up into this. Okay, now this is interesting in relation to chemicals, okay? Because when we are in breathing dysfunctions, it can lead into a sense of a shift within our internal environment within our body, okay? Now, within our body, we have these chemoreceptors. They pick up on, oh, my body's a bit acidic. Oh, my body's, a little bit alkalinic today. And it's going to change and it's going to shift our breathing, okay? And we need to be mindful of this with breath work because this can occur. So within our central chemoreceptors, we're coming back up to this base and this brainstem again, this region within the medulla. And this area of our brain detects the change of pH within our spinal fluid. Now, how amazing is that? Our spine has this fluid that surrounds it, and the chemoreceptors pick up on a shift, pick up on a change. And then they can be desensitized over a time from if there's oxygen deficiency, and if there's oxygen deficiency and an increased carbon dioxide, this then is going to send off a message to go, oh my goodness, I need to take a really deep breath in. Whew, okay, then I can get more oxygen in. Or it will be, oh, I need a yawn. Because what happens when we yawn? If we yawn and we hyperventilate, we get more, we get more carbon dioxide off our body if there is that sense of pH imbalance in our body. Now, within the peripheral chemoreceptors, this other area that can detect and receive information from our chemical balances within our blood, these are located within that large aorta, the large artery, and that can detect the difference within the oxygen and carbon dioxide, not the pH, but the carbon dioxide and oxygen, and then that will have an effect on our respiratory rate. That then goes, oh, you need to increase or reduce the respiratory rate that we have. Now, this is all a bit ready and righty, okay? I don't want to get too stuck in this because this can be a bit like, oh, need a yawn. So it's interesting in how we speak about hyperventilation and hypoventilation. We're just going to concentrate on these two words. What does hyper mean? Thumbs up for too much or thumbs down for not enough? Hyper, yes, too much. So hyperventilation causes alkalosis, which can then create a feedback into our body, shifting our ventilation, shifting our breath, increasing the carbon dioxide because we're breathing too much.
Can everybody make sure they're muted, please, other than Rachel?
Check out your coughs if everyone's all right. Have a quick drink. Okay. And then we've got the hypoventilation, hypo, not enough, which causes acidosis, which can then increase our ventilation, removing the carbon dioxide. So carbon dioxide creates acidity. Remember that? It's a really, really good one. Because what else can cause acidity within our lives without our breath changing? What else is really important? Our food. If we're eating processed food and we're eating really a crappy diet, this can have a huge input into our internal environment within, are we becoming too acidic? Are we becoming too alkalinic? So food, our diet, has a huge influence on our internal environment in relation to acidity and alkalinity, and so does our breath. So if we look at our breath, we've got to look at how we're breathing. Is it shallow? Is it too much? Do we yawn a lot? There's lots of different things there to consider. So this is going to bring me on to talking about breathing dysfunctions. Now, I've mentioned a few. Would anybody else have any other breathing dysfunctions that you can think of? Anybody got a breathing dysfunction that maybe they have themselves? Maybe they are, that you think what could be? Yeah, asthma. Fantastic, Brenton. Asthma. What happens with people with asthma? What happens to their breathing? Go for it, Sabine.
Construct.
Okay, it's short. Lena says short. Carlos says short. Shallow. In which way though? Because we have an inhalation, we have an exhalation. What happens to an asthmatic?
Inhalation.
Okay, so they end up in full inspiration and they find it really, really challenging to get the exhalation. So what do they end up happening inside of themselves? If they keep breathing so much in, then they're not getting what out?
Lots of oxygen.
They get so much oxygen in, they're not getting enough carbon dioxide out. Yes. So that therefore can create an acidic environment. It can create our whole thoracic cage to look like it's expanded and held in inspiration. And for that person, they need to learn how to breathe out. That's really important for them. It's almost like a balloon. Here's what I prepared earlier. It's almost like a balloon that we've got to deflate, because this person is held in inflation and they can't get it out. Really, really interesting. Same as people with COPD, chronic obstructive airway disorders. You will see these people, they have very, very expanded thoracic cages. They look like they've got a really big, solid body, and they are held in inspiration. They need to learn how to breathe out. What else is going to what else are we going to see as a breathing dysfunction? Any other thoughts? Here we go. Here's a list for you all. Everybody slouch if you're not already. Have a real kind of like, oh, you're probably feeling a bit pissed off today, having a bit of a slouch. How does your mood affect your breath? Have a real sense of slouching. It's not helping my digestion. Who's ever held their tummy in because they want to have a sense of looking like they've got a flat stomach? Putting their tummy in, not allowing the diaphragm to move and excurse and to have this sense of a jellyfish. People that have got digestive problems, people that maybe fart a lot, people who have a lot of wind, people that get achy tummies, people that are bloated, may get a breathing dysfunction from the digestive issues. People with a very stiff thoracic spine, because then they're unable to get the sense of the ribs being able to expand, to be able to create more space for the air to come in. We spoke about asthma, anxiety. Uh-oh, this is our number one. I'm stopping the share because it is massive. Who's suffered from anxiety in the past? Yeah. And what happens with your breath when you are anxious? Type it away. It reduces. Yes, Carlos. It seems to become shallower. Now, if we have a 0 to 100 capacity of breathing out to breathing in, think about where you are within your 0 to 100. Just think about where you are within yourselves and how that may even shift through your day. Yeah, some people have a tendency to hold their breath in. What's it like if you talk too much? After I've been chatting away for 2 hours, oh my God, I'm sending off so much carbon dioxide that I've got to go, oh my God, let's get some air in me. Okay, some people forget to breathe. Amazing, isn't it? We think, where does it all stem from? The breath moves into the higher upper chest. Yeah. So these muscles that I'm going to tell you, I call them trash muscles because they take on a lot of shit. Okay. If I take a deep breath in, can you see these guys at the front of the neck? If you all take a deep upper breath, all up here, can you see these, how they are standing on end? Okay. Now these muscles are incredibly important in our lives for lifting up our first and our second ribs. So they are highly functional for the upper rib breathers of the world. And where do these guys attach? Straight into our neck. So we've got to think, upper rib breathers may end up with neck problems. In between these muscles travel a very important 3 structures, a vein, a vein, an artery, A, and an N for the nerves. All the nerves that supply your whole arm go between those 2 muscles. They're called the scalene muscles. The scalene. Let me just pop that in there for you. Scalenes. There are 3 of them. And we have very, very important structures that go through them. Okay. The vein, the artery, the nerve. Anybody have any questions? You all look very thoughtful, I have to say. You're all right about there. Okay, so breathing, the breath, the ribs, that 3D nature of our breath is so, so very important. How do you teach people to breathe? How do you breathe yourself? Do you wear a bra that's too tight? Do you wear trousers that are too tight? Start to observe people with their breathing. Some people take a very quick snatch when they take a breath in. Some people will pause and breathe in through their nose. People are in pain. Where does your breath go? Have you been winded? Has the breath been taken out of you? Whether it is from a psychological point of view, maybe a psychological trauma. And when we are talking about trauma and we then start to release the trauma from within, the breath can shift. The breath has an amazing ability to almost regulate again. It's almost like we want to defrag ourselves. There's a real sense of, even with the breath and with crying, how's that if we get into a really good deep cry? How does that diaphragm feel? It's kind of doing this whole thing of having a good old shake. And then think about what's happening to the nerves. What happens to the nerves up into the base of the brain? What happens to the nerves into the C3, 4, 5, keeps the diaphragm alive? What happens to our whole breathing jellyfish capacity? Okay. I'm gonna leave the space now for any other questions that may come up. Otherwise, I'll keep talking and then people don't get time for questions.
There is a question in the chat box from Sabine that says, do we actually have chemoreceptors measuring oxygen or only the level of CO2?
Good question. What I'm going to do is I'm going to share you a link. And to be honest with you, I'm not 100% sure. So I'm not going to say one or the other or make it up. Because I think it's really important for us to find that out. So I am going to place this amazing, fantastic research that I found, and I'm going to share that with you, and you can all nab that and go and have a good look at it, okay? Now, whether it's if you've got too much oxygen, then you're not going to have enough carbon dioxide. So whether it's one or the other, the body's going to make the shift, right? So I don't know. Does it matter to us? Maybe it does. Go have a really good look. I love your question, Sabine. Not dissing it by any means, but go and check it out. And I reckon you'll probably get that information in that chapter of the breath. My physiology is not tip top. Give me a bit more anatomy, not a problem. But physiology, not my cup of tea.
Okay, and for anybody else that's got questions, put them in the chat box. That way we can get to them in a timely way. There's a comment higher up, Rachel, it says, sometimes I feel I need to take a really deep breath over and over, like for a day, and can't quite get a satisfying one. Yawning helps, but it continues to happen. Would you have anything to say about that?
What comes up to me there, Anthony, straight away, and for whoever asked that question, is have a think, are there any physical limitations within your body? Sometimes we have restrictions. I know, for example, if I've got a bit of a rib problem or my thoracic spine feels really tight, especially over this period of time that we're all in, I'm not moving my body as much and I'm feeling a lot stiffer. And what range of motion is the best range of motion for our thoracic spine? Twist it, baby. Twist that thoracic spine and wring it out, okay? I would suggest you wring it out, twisting from above down, okay? Even just sitting. Place your right hand onto your left knee, hold on to the back of the chair, twist. Once you've found your twist, breathe in. Breathe in and expand into your lower ribs. And as you breathe out, use your abdominal muscles to take you a little bit further. And really get a sense of you being wrung out, and twist those thoracic vertebrae, twist those ribs, and see whether that feels different. I will also often use a spiky board down my thoracic spine and work down through those ribs. So the question in relation to that, think about, is there any physical limitations within your skeletal muscular system? See how that goes.
Thanks. And I know we've only got 1 minute left, but we've got 3 questions. So let's see what we can do with them. Would you be able to say more about how slouching can hinder breathing?
Yeah, sure. Think of the orientation of your diaphragm. If you have good posture, say the diaphragm almost looks a little bit like a question mark, okay? What's it going to look like when you slouch? You've got even a bigger question mark. It really starts to hook right over, okay? Now, those attachment points, the top attachment point gets lower down. So the whole orientation of the diaphragm then has a different way to work. It's got different anchor points. And then what happens to the ability for your ribs to actually move when you slouch? If you slouch, I can't get a breath into my stomach because my stomach's compressed. So then the tension and the pressure will also shift within that region.
Thank you. And what do you think about tapping on the rib cage and abdomen?
For what?
I'm presuming Attila's coming from the kind of Tai Chi exercises. I'm not sure there, but we need some clarification on that.
I think tapping, in relation to tapping, what's it going to do? If you create any kind of connection with the body, you are going to bring awareness to it, right? Our skin, this is gorgeous. This goes into embryology, which is, you can geek right out on this stuff. Our skin is an extension of our nervous system. It comes from the same embryological tissue when we're about 2 weeks old. 2 weeks old, we have 3 original tissues that every single cell that you have in your body right now originates from. So if we create some sense of touch into the rib cage, some sense of tapping, people may go, oh, okay, yeah, I can feel that, because they may not be actually somatically connected to that area in their body. How many people have you had tap on your spine recently? Not too many. So all of a sudden, that may create a sense of expansion. It may create a sense of, okay, now I get where you want me to breathe into. So I hope that one helps there.
It did. And we've been given another couple of minutes extension here. So I want to ask you another question. How about us women used to keeping our bellies flat to look better? Does that influence our diaphragm and our vagus nerve and everything else, therefore?
Let it all hang out, girls. Let the muffins hang out. We just so got to, because we're not doing ourselves any favors at all. So yes, holding your tummy in does make a difference.
Well, I think that's the same for men too, isn't it?
It is the same for men, Anthony. You're so right, because men do hold their tummies in too. Absolutely. Absolutely.
And you can't have a 16 pack or like mine unless you let it hang. So I agree, the Buddha belly is best.
It's all right having a 1-pack too, isn't it?
Yeah, it is. Yeah, one sack. Yeah.
A 1 sack. I mean, the 6 is under it, but the one's,
Yeah, the 6 is in there somewhere, but I don't bother find it much anymore.
It's down there.
Just enjoy a full round breath. Okay, I think we're drawing to a close.